Beth Morey of St. Regis Falls, New York, loves a road trip and is very familiar with the drive to and from Central Florida.
I enjoy traveling, and here we are in the middle of Florida and trying to escape the cold weather from where I'm from. I'm from northern New York, and it's very cold, lots of snow up there, and so this is beautiful weather down here. And I camp in a little pup tent and wasn't able to do that while I was in surgery, or prior to my surgeries, because of this situation of pain. So now I can stoop down, get in and out of that tent without any trouble at all. Get out and do a lot of things, a lot of walking and a lot of enjoying the weather.
But traveling was not always easy for her. Over the course of her life, everyday functions became increasingly difficult. This was a result of some unfortunate accidents and the development of degenerative spine conditions.
My situation started back with a couple of car accidents. I had a whiplash that I didn't take care of properly. Led into a couple of other situations where I had rolled an ATV. And so I also realized that I had degenerative disc disease after going to a regular primary doctor. And I started going to the chiropractor and thinking that would help for a short time. Had to keep going back. So I went back to the primary doctor and then started taking pain medication. Didn't really like pain medication, but did what I needed to do so I could continue to function and enjoy my life. My neck area, the pain started when I was getting to the point where I couldn't move my neck back and forth very far. And this was about as far as I could go. Now, after the surgeries, I've got a lot more range of motion. But that's where the pain had started and where I had the initial pain. My lower back had problems as well. So I had pain in the lower back. I started to walk around like, if anyone's ever seen the Carol Burnett show, and it's on Tim Conway, he walks around like an old man in the clock shop, all stooped over. That's how I was walking, and that was very uncomfortable and too hard to get up in the morning and try to function. So I looked into the areas of getting it corrected. My first accident was when I was 18 years old. So that's when my first whiplash was. Like I said, it's progressed since then from the other injuries that I have obtained. A good 30 years that I've been suffering off and on. Didn't know what I was going to do. Like I said, I would keep going back to a chiropractor. And he'd work for a little while, then I'd go to a different one, or physical therapy. Well, that was a lot of fun too. Not really. So, like I said, I wanted a long-term fix for something that I had been long-term waiting for, not one that likes to go and have surgery, get caught under the knife. So I didn't really pursue that until, like I said, I was taking so much medicine. Within the last 3 or 4 years, I was taking gabapentin, several per day. And I don't like taking any type of pain medication, so I started weaning myself off it, and that wasn't working, so that's why I contacted the Bonati Spine Institute.
Beth knew invasive surgery was not an option. After doing some research for alternative methods and learning about Bonati through word of mouth of friends, she contacted the Bonati Spine Institute.
I've known other people have gotten surgeries done through the front of their neck, and I just didn't think that was the procedure I wanted to go through. So when I researched and checked into the Bonati Spine Institute and saw what Alfred Bonati has patented and done for the spine areas, I thought that was definitely what I needed to do. So I gave him a call, and he was very, very receptive and said, yes, you need to come down. Maybe you should come next week. So a couple of years ago, when I had the surgeries, on my consultation with Dr. Bonati, he pulled up all the images because they had already received my MRI, but he sent me over for some more as well. So he took a lot of time to explain what it is that needed to be taken care of, what would be corrected. He realizes that I also have arthritis, and some of those things cannot be corrected in the spine surgery, that there will be a little bit of pain, which is very tolerable considering how much has been corrected, because the spine, I have degenerative disc. I think it was the 4th surgery or the last surgery that he said he did an awful lot of work in there, corrected a lot of things. And after I've recovered, I realize everything is so much better than it was before.
Due to issues in both her cervical spine and her lumbar spine, Beth was scheduled for multiple procedures. Because of the patented techniques, small incision, and use of conscious IV sedation, the Bonati spine procedures are performed on an outpatient basis, and many can be performed in a short period of time.
Dr. Bonati instructed that I would probably need 4 surgeries, and so they started with my neck. and took me into the procedure for the neck surgery. And it's a really neat operation because you lay there on your stomach and you can watch everything that's going on. So they let you know, let me know if anything hurts, because that way I'll know exactly where we're working to make sure that we are correcting the area that you need corrected. So he cleaned out a lot of calcium or whatever that builds up on your bones to clear those passages so that my nerves would no longer be pinched. So he did the neck first, then he did a few days later. I was recovering. He went and did the lower back. Then he went back up and did the neck and back down to the lower back. During the procedures, they first get you the IV and get you calmed down, but you don't feel the pain. You're laying there and you're very comfortable. You're watching everything, which is just like watching a medical show on television. So it was very, very neat. They'll ask you, well, if you feel anything, if there's any pain, please let us know. So he says, well, just let us know exactly where the pain is. So I did. So that was very helpful. I thought, I couldn't imagine having the surgery without knowing, how would they understand exactly which piece was the problem? I think it's very helpful that you're awake for it and you can tell them exactly where it hurts. And that way they can correct everything that needs to be corrected. So it was an awesome procedure.
For many Institute surgical guests, the abbreviated recovery time is surprising. Most find they can return to normal activities sooner than later.
In the recovery room, they let you know that you need to walk 4 times a day. The recovery, like I say, is so quick. I was amazed that you get right up out of recovery. Once you're feeling well enough, you just get right up, walk around, get your stuff ready, and you're out the door. It's great. I was down there for, I believe, 3 weeks, and it was the best 3 weeks because I was corrected with everything. Everything was done, was able to come down, and I went back in a home and I recovered for about a month. I would say the pain subsided shortly thereafter the surgeries because, you have the pain from where the surgery was, obviously. I can now bend over a lot easier than I did before. I can squat down and get up and move around a lot faster. Well, like I said before, I was walking very slowly. I wasn't able to manipulate myself and get down and do things that you could do as a regular human, actually. So it was very limiting prior to the surgeries. And by the time I got back home 3 weeks later, I was doing fine. I was still walking and doing everything that I wanted to do before that I couldn't do before.
Part of getting better is feeling understood by those who care for you. Beth believes that the collaborative and targeted approach of the Bonati team allowed her to reclaim her life.
Anyone I see that has situations similar to mine and they're thinking about going somewhere and having the surgery done, and I said, well, you really need to check out the Bonati Spine Institute. I said, I know there's so many places that they'll do the cut in the front. How many things do they have to go through to get to your neck? And I believe this is the place that goes directly where you need to go. Even if my insurance hadn't covered it all the way, I've got a feeling I would still have come down here because I can't imagine anyone else that would do the procedures that I needed to have done to make myself feel so much better. Everyone at the Institute is so friendly and so cordial and so helpful. Dr. Swanson was my anesthesiologist. He was phenomenal. Dr. Bonati took the time to explain how everything needed to be taken care of and what things might not be taken care of. So he let you know good and bad, which was very important because you need to know that before you go into those procedures. And so I thought he was excellent at what he did as well. They were all very good people to work with. I couldn't imagine it going anywhere else, like I said. I probably have said that too many times, but it's just a great place, and that's why I felt this interview was so necessary, because I know that there are a lot of people that really need to have these procedures done and get their quality of life back.